101. How should you control bleeding after the normal delivery of an infant? A. Pack the vagina with sterile gauze. B. Apply direct pressure to the genitalia. C. Elevate the pelvis. D. Perform fundal massage. Answer. D. Massaging the top of the uterus stimulates it to contract and promotes control of normal postpartum bleeding. 102. A green stick fracture is one that is A. Open. B. Impacted. C. Partial. D. Comminuted. Answer. C. A green stick fracture is a partial fracture that is on only one side of the long bone. These fractures are noted most frequently in children, but may also be seen in adults. 103. What should you do to care for a patient with a suspected pelvic fracture? A. Apply the PSG/MAST, titrate 2 IVs to effect, and monitor for signs of shock. B. Immobilize the patient to a long spine board, start 2 IVs, and transport immediately. C. Gently align lower limbs, soft splint with a blanket and cravat, and administer analgesics. D. Do not immobilize, monitor distal pulse and sensation, and transport immediately. Answer. A. This is the current field treatment regimen for pelvic fractures. The PSG/MAST is used as an air splint to contain the fractured pelvis and prevent further injury. 104. Your patient has a chemical burn to her face and eyes. How should you treat this? A. Cover the eyes and face with a dry, sterile dressing. B. Apply a paste made of baking soda and alcohol to the eyes. C. Apply a neutralizing agent to counteract any chemical reaction. D. Brush the chemical away and then flush the area with copious amounts of clean, cool water. Answer. D. The correct treatment for most chemical burns is to flush the area with cool water immediately and to continue this treatment even during transport. 105. The first step in managing a burn patient is to A. Estimate the percentage and degree of burns. B. Assess airway and breathing status. C. Prevent contamination by applying sterile burn dressings.
D. Stop the burning process.
Answer. D. The first step in managing a burn is to stop the burning process, or the burn will continue to destroy more tissue. Then attention should turn toward ensuring and maintaining an adequate airway. 106. A burn wound that blisters is an example of A. First-degree burn. B. Second-degree burn. C. Third-degree burn. D. Chemical burn. Answer. B. Blister formation is characteristic of second-degree burns. 107. An adult who has burns over both sides of one arm and both sides of one leg would be estimated to have total burns over what percentage of body surface area? A. 9%. B. 18%. C. 27%.
D. 36%.
Answer. C. Using the rule of nines, this patient has burns over 27% of her body surface area. Both sides of one arm equals 9%. Both sides of one leg equals 18%. 108. Your patient is a comatose 56-year-old male. His breath smells fruity and sweet, and his respirations are very deep and rapid. After the initial assessment, you should provide which of the following treatments? Answer. A. This patient is showing signs and symptoms of diabetic ketoacidosis. Avoid the use of glucose administration if at all possible. At the minimum, you should obtain a glucometer reading before administering any glucose-containing solutions. The fluid bolus will help dilute the glucose contained within his blood. 109. Signs of hypoglycemia include which of the following? A. Nausea and vomiting, tachycardia, abdominal pain, deep, rapid respirations. B. Weak, rapid pulse, cold, clammy skin, headache, irritability, coma. C. Shallow, rapid breathing, low blood pressure, warm, dry skin, irritability. D. Decreased blood pressure, pulse, and respirations, loss of consciousness. Answer. B. This option lists the classic signs of hypoglycemia. 110. Naloxone is given to patients who are suspected of having which of the following conditions? A. Narcotic overdose. B. Wernicke's syndrome. C. Korsakoff's psychosis. D. Increased intracranial pressure. Answer. A. Naloxone, Narcan, is a narcotic antagonist given to patients suspected of narcotic ingestion. 111. Patients who are found in a hazardous materials incident should be initially treated in which containment zone? A. Hot. B. Warm. C. Cold.
D. Moderate.
Answer. B. Major decontamination and treatment for life-threatening conditions should be conducted by properly protected personnel in the warm zone. 112. A patient presents with symptoms of flushing, itching, hives, difficulty breathing, decreased blood pressure, and dizziness. What should you suspect? A. Diabetic coma. B. Anaphylaxis. C. Acute appendicitis. D. Stroke. Answer. B. Hives, accompanied by difficulty breathing, strongly suggest anaphylaxis. 113. After the administration of epinephrine, what may be given to help epinephrine stop an allergic reaction? A. Oxygen. B. Diphenhydramine. C. Albuterol.
D. Terbutaline.
Answer. B. Epinephrine is the first-line drug for patients with severe allergic reactions. Oxygen, albuterol, and terbutaline are all respiratory drugs, but they do not have any antihistamine properties. Diphenhydramine, Benadryl, is an antihistamine and will stop the production of histamine, the chemical responsible for the exaggerated immune response. 114. What is the reason for giving inhaled beta agonists to patients with severe allergic reactions? A. To increase heart rate and contractile force. B. To block histamine receptors so edema is lessened. C. To help suppress the inflammatory response. D. To reverse bronchospasm and relax airways. Answer. D. Beta agonists such as albuterol help in the treatment of severe allergic reactions by relaxing the airway and thus relieving bronchospasm. 115. A patient is covered with alpha-radioactive material after an accidental spill. An adequate level of shielding would be A. A lead apron. B. A concrete wall. C. A cloth uniform. D. Aluminum foil. Answer. C. Alpha particles carry very little energy. A uniform is adequate protection against such a contaminant. 116. What are the classic symptoms of narcotic overdose? A. Altered mental status, euphoria, and dilated pupils. B. Excitability, hyperactivity, and hypertension. C. Respiratory depression and constricted pupils. D. Cardiac dysrhythmias and altered mental status. Answer. C. Respiratory depression and constricted pupils, pinpoint pupils, are classic symptoms of narcotic overdose. 117. Your patient is a farmer who has employed a crop duster to spray his fields. The fields were sprayed earlier today, and now the farmer has teary eyes, nausea and vomiting, diarrhea, and excessive salivation. What was he most likely poisoned with? A. Organophosphates. B. Nitrogen-based fertilizer. C. Cyanide. D. Carbon monoxide. Answer. A. The symptoms of organophosphate absorption are described by the acronym SLUDGE: excessive salivation, lacrimation, urination, diarrhea, gastrointestinal distress, emesis. 118. Shivering ceases in a hypothermic patient when the body temperature drops below. Answer. B. Shivering is the body's attempt to regulate body temperature. Shivering continues until the core body temperature reaches about 86 degrees Fahrenheit. Lack of shivering in a hypothermic patient indicates significant hypothermia. 119. Which patient presents the signs and symptoms of moderate hypothermia? Answer. B. Moderate hypothermia is characterized by a core temperature between 86 degrees Fahrenheit and 94 degrees Fahrenheit. 120. What is the correct field treatment for a frostbitten body part? A. Transport the patient to the hospital. B. Rub the affected part with crushed ice or snow until warmed. C. Warm the affected part in water maintained at 100 to 106 degrees Fahrenheit before transporting. D. Cover the frozen part tightly in wet occlusive dressings. Answer. A. The correct treatment is gradual warming in a water bath maintained between 100 degrees Fahrenheit and 106 degrees Fahrenheit, although this treatment should not be attempted in the field because of the danger of refreezing. Pain management is essential because the procedure is extremely painful.